Okay guys, the last lecture in the series of the muscles of the upper body in the head and neck area is going to be about the muscles of the neck that move the head, and we're only going to tackle a couple of these muscles. The neck can get pretty complicated, but we're going to be talking about this one right here, this one here, and then also a couple underneath in this region. So you'll need the handout that has the 4 muscles on it, and then on the back of that handout is the review diagram where you're supposed to label. So let's go ahead and get started. Alright, the first one we're going to talk about is going to be the sternocleidomastoid, and you'll see me abbreviate it the SCM at times. Yep, that's a big name, sternocleidomastoid. But in reality, if you pay attention, you can understand where it's attached. So let's take a look. The sterno part of it is attaching, tells you it's attaching to the sternums. Let me get my tools here. Right there to the manubrium of the sternum. The cleido part is telling you it attaches to the clavicle. And the mastoid part is telling you that it attaches to the mastoid process of the temporal bone. So essentially this muscle is named for its 3 attachment points, its 2 origins, and 1 insertion. So yep, I said this is the origin here, there's another origin here, because really how much does your sternum move? Hardly at all. And then the insertion is going to be up here on the mastoid process. So what do we have so far? 2 origins, manubrium of the sternum, sternal end of the clavicle, and 1 insertion, which is the mastoid process of the temporal bone. Okay, so what about these actions? Well, this is a pretty important muscle, the neck. You can see this other picture down here. It's very recognizable when someone moves their head in the right way. You can see it. In fact, you may have seen mine in class when I was talking about it earlier. So we've got some important actions that are happening here, and it's going to pull the head by anchoring in the front. So maybe you can start to imagine that the mastoid process can be pulled towards the front if you're using one side, and that's actually going to cause rotation. But if you're paying attention and you understand, it's going to cause rotation to the opposite shoulder. So in other words, what I'm looking at right here is the left sternocleidomastoid. That's going to make this little skeleton dude look to his right. So the left side makes you look right, the right side makes you look left. So we have the action of rotating the head towards the opposite shoulder. Now, in addition to that, you can also probably understand how this muscle would cause lateral flexion, and so that would cause the bending of the head to the side, and that would be, of course, to the same shoulder. So that's if you use one at a time, because we do have a second one over here on the other side. Now what happens if you use both of them at the same time is that it will cause the head to bend towards the front. And so when you bend your head towards the front, we call that neck flexion. So that's going to be bilateral, using the muscle on both sides, causing flexion at the neck. Now this is a little hard to kind of feel if you're trying to feel these out. If you are just like putting your head down with gravity, but I'd be willing to bet that if you have ever done any sit-ups or crunches, after a while you want to hold your head because your neck muscles start to hurt as you're holding your neck muscles are having to hold your head up against gravity. Then you're probably aware of the sternocleidomastoid. Alright, so check those out. Maybe on your neighbor or on one of your friends, and see if you can identify the sternocleidomastoid and see how it's going to work in all 3 of these different actions, so a major mover of the neck. Alright, right next door, so actually I'm going to take my little pen and I'm going to draw in the sternocleido-ish, kind of. And we'd have another little pink attachment there to the sternum and clavicle. What I'm looking at, okay, I'm going to change colors, is in this area here. I'm not a very good artist, but it's going to be in this vicinity, not this big dude back here. We'll get to that later. But in this little area here, you can see, I didn't do a very good job drawing it, but here you go. 1, 2, and 3 muscles that are called the scalenes group. So these ones, this is kind of a, what is it, massage therapy terminology, because lots of issues with the scalene muscles can cause really weird problems in your arms and with you know, things of the thoracic area because they attach in a lower position. But what we're seeing with the scalenes, and you'll see them on your picture, is that they will help the sternocleidomastoid. So I put down that these are helpers to the sternocleidomastoid, or the SCM. They do rotation of the neck, lateral flexion of the neck, and when you use them bilaterally, also flexion of the neck. So we see the same exact 3 actions that we just saw with the sternocleidomastoid. And you're looking up here at the title and saying, wait a minute, what's all this? I'm hoping you can figure this out. This is the anterior scalene, the posterior scalene, and the middle would be in between them. Okay, so it's going to be in this area right behind the sternocleidomastoid, in between the SCM and this muscle back here, which is the trapezius. So there we go. Here's the trapezius, and I use this as an example, I think, before, maybe talking about the different grains of the muscle. So I want to just put that out there. Here we got some grain like this. We've got some grain like this. Okay. And then we've got some grain like this. So we're going to find 3 distinct actions. Notice where these are attaching them. I'll change color here. They're attaching all in this vicinity. But we also have an attachment up here, and this is the one that I want to focus on. So let me get rid of all that. I'll draw my arrow again. I'm going to focus on this attachment. How is this muscle going to move the neck? Well, you can probably guess. So first thing I want to say is that you got to notice the multiple grains. Second thing is that the action is going to depend on the part of the muscle that is active. Because we have multiple grains, the muscle can be active in different regions. And you can see in the diagram, it's talking about upper fibers, that's another word for cells, middle fibers, lower fibers. But what about the neck? Because that's what we're focusing on. Well, this one is a neck extender. So as you might understand, it's going to be able to pull that head towards the back. We've got an origin all down the middle. Pull that head towards the back. This would be a good one to draw on. Pull that head towards the back. And that's going to cause neck extension. So if you've done a lot of let's see, watching a fireworks, or if you sit really close in the movie theater, you know, your trapezius starts to hurt after a little while because you got your head tilted back. So that we'll come back to this one. My last note is that, let's see, we will also see this muscle as a scapula mover, so you may be able to guess what it's going to do to that. But for right now, we're looking at neck extension. And the final muscle is called the splenius, and actually the splenius is really 2 different muscles. We've got a splenius capitis, which attaches to the occipital bone, and then a splenius cervicus, which attaches to the transverse processes of the first couple, the cervical vertebrae. But in reality, we can just refer to this as splenius, and you can see them down here as well. So I mentioned that it does have the 2 sections. I just want you to know splenius, and that the major actions, maybe you can guess, take a second, pause and guess if you use these individually, like left side versus right side, and if you use them together. So take a guess, and hopefully you did that. So muscle actions, if we use them individually, we're going to get rotation. It's going to pull that occipital bone towards the back and cause you to look to the side. You can also cause lateral flexion. This will be bending, of course, to the same side as that muscle shortens. And then if you use them both, just like trapezius, we get neck extension. So our origin is going to be all along these spinous processes of the lower cervical and upper thoracic vertebrae. And the insertion is going to be here. Okay, so I'm hoping by this time, a little bit under there you can't see, that you have figured out how muscles work and this is all making sense. All right, that's the end of this lecture. See you next time.